Welcome back to Isaac's Dentistry. Today we got something a little different but special planned for you. We've talked about extractions and different things we do here in the office. So today what we're going to do is we're actually going to take you into our operatory as we perform a couple of extractions of maxillary or upper teeth. So I just wanted to give you a heads up of what you're about to see. It's going to be a live extraction, kind of give you an idea of what goes into the extraction and when we do extractions, how the process goes and what it's like to actually sit for an extraction. We avoid them at all costs when we can, but there are some times where you just have to have a tooth extracted. So hopefully today will be really informative for you to see just how an extraction goes, what it takes to have a tooth pulled, and the different things that may pop up procedure, during the procedure, and then the follow-up on how to take proper care of the extraction sites once you leave the office. So here we go. We'll get in here and we'll go ahead and we're going to get started with a couple of extractions of one of our patients today. Thanks for joining us here at Isaac's Dentistry.
Okay. Now I'm going to put a ton of pressure on you, okay? Just like before. Yeah, it shouldn't be bad. You go ahead and do what you need.
So the biggest thing with extractions is we've got the patient very numb. So the pain factor isn't really an issue. What we're dealing with is a lot of pressure. It takes a ton of pressure to get teeth out when we're doing an extraction. So as the doc's doing things, as his assistant, I will constantly remind people, here's where you're going to feel pressure. At the different stages, right now, Doc's luxating that tooth and trying to loosen it up. And this is where the pressure will start to kick in.
A little bit of anxiety, but he's doing good.
And as we loosen that tooth, Doc's feeling for different parts of the tooth that might give. If it's a real fragile tooth, he's also getting a good idea if it may want to break on us and cause a small complication. And I say complication, but we see it all the time. It doesn't really change what we're able to do. So now once we get to this point of the extraction of actually grabbing that tooth to pull it out, this is where the pressure intensifies. Here's that big amount of pressure, okay, bud? Doc will pull on it in different directions and put steady pressure and then release, and then he'll go back in and put more steady pressure on it.
Sometimes we do it. Just do suction that a little bit.
Yep. Open real big.
And right. Just a little bit. Okay, now it's over.
Tongue out. And again, we're moving to a different area of the mouth now. Doc's gonna loosen the tissue around that tooth, so we're not being held in with any of the tissue. Then, just like you were seeing a few seconds ago, we'll get in and we'll luxate it again. And this is an important part because it gives Doc a lot of manual feedback. It tells him how well the tooth is moving.
Okay.
Gives him some feedback on the difficulty of the extraction, the weakness of the tooth possibly. So other than loosening the tooth and prepping it to actually be extracted, this is a portion of the procedure that gives Dr. Isaacs a lot of feedback on how the process is going to go and gives him some heads up on what he's going to need or may need. So again, he'll grab it with the instrument and start putting pressure on it. And just like that, it'll slide out. So in just this short amount of time already, doctor's been able to get 2 of the teeth out.
Try to relax, good. Lots of pressure.
This is the pressure. You're also, on these uppers, you're going to hear some of those Rice Krispies in your ear too, because we're getting back close to that ear canal. On these uppers, when we get further back, you'll hear some noises in there. Can be unsettling because you've never heard them before, but for us, it's actually normal. It actually tells us some things too. I always describe them as Rice Krispies. You hear a little snapping and crackling, and what that actually is the ligaments that are helping hold that tooth in starting to break away and release that tooth. So again, the steady pressure to loosen that tooth up even more, and then the releases them back into pressure. It's like trying to loosen a screw or something like that. You put that heavy pressure, release it, and then go right back on pressure, and it helps to loosen the tooth to get it out.
Okay, there's 3. We've got a couple of roots over here.
Just like that, we've got 3 out. So now we're going to go to the other side. There's a few roots that are in there. Open real big. Go ahead. So now Doc's going to go in on one of the teeth that had some roots left in.
Okay.
He's got a good visual on them. We make sure we can keep it clean with our suction unit.
Okay.
And he'll go in to get a good grip on those tips. We don't want to leave tips behind. They can cause irritation and other minor complications down, so we try to get all of the tooth out. Depending on bone density, there are some times where it's more prudent to leave tiny little tips in there and just let the bone heal over them. In this case, it's going to be better for the patient, and it's going to be less irritating to go ahead and make sure we get the tips and everything out. There we go.
Okay, section E.
Open big. And again, as you can see, even with all these tips coming out and the teeth being pulled, we've administered enough lidocaine to numb the patient.
No pain. Patient's good.
And this way, the patient's only feeling the pressure and not any pain. Get a little more light on for Doc. And what he's doing is Doc's being very careful as he goes in to grab these tips, not to break them or push them into a different location.
Put a section right over top. Okay, let's go.
Got it?
All right, so we got out full on him. Let me see if I need to put any stitches in here.
So in just that short amount of time, we've already been able to pull out 4 teeth on this patient.
Now close down just a little bit.
One of the great things in our office, we've got a couple of sayings,
Right now? Okay, good.
especially when it comes to extractions or any kind of procedure we do. You know, one of our favorite ones is never skimp on Novocaine. We don't like patients to be in pain, so if we need to use more Novocaine, we do. So we try to maximize it as much as possible. You all right?
You smile? Good, you got a smile. Okay.
Got a smile and a thumbs up, so
And any extraction you can walk away from is a good one.
there we go. So right there, you can see how quickly we were able to get 4 teeth out on a patient. There's always, people always talk about, you know, I got to get my teeth cut out. As you can see, there was no cutting. Teeth very rarely have to be cut out. And in those situations, we consult with oral surgeons and different people to see what we need to do. But what you were able to watch with us today is what we do every day here at Dr. Isaac's offices. We do extractions every day. We do fillings, we do the wide range of dental procedures. But we wanted to bring you into the operatory, give you a chance to see firsthand what an extraction is. I'd say probably the two things that scare people most when they walk through the door here is getting a tooth pulled and getting a root canal. So hopefully this demystifies the questions and the misnomers about having a tooth pulled. And we're glad we were able to bring you into our office and give you this firsthand experience and educate you on how we get teeth out and just how simple and how efficient the process can be if it's needed. Again, let me reiterate, getting a tooth out on the patient is always our last resort. We want to restore teeth, we want to fix teeth, but if we have to, if that tooth does have to come out, we're fully capable here and we do it all the time. So I want to thank you again for visiting us here at Isaac's Dentistry. If you have any questions, feel free to give us a call, or even better, stop in our office, make an appointment just to sit down in one of our chairs and chat, and we can answer all your questions and hopefully get you on the road to recovery and good oral health. Thanks again, and we'll see you next time right here at Isaac's Dentistry.